It was in the early 70s and at the end of our second year at USD Medical School. All sophomores left the classroom to spend the last month with a practicing doctor out on the South Dakota Prairie, and I was assigned to Madison, South Dakota. There I heard of a case of meningitis that had happened a few months earlier. The teenage girl came to the emergency room with severe headache, spotty rash, stiff neck, high fever, and confusion. Recognized as possibly meningitis, the wise doctor and the emergency room team quickly performed a lumbar puncture, also called a spinal tap. In addition, blood cultures, IV fluids, and broad-spectrum antibiotics were started within minutes of the patient arriving to the hospital. The shocking nature of this story was that over the ensuing hour, despite all the correct actions taken, the girl died. A day later, cultures of blood and spinal fluid came back positive for Neisseria meningitides, a type of bacteria that can spread in an indiscriminate and epidemic way through communities of healthy young people, such as high school classes, army barracks, and college dormitories. Prior to antibiotics, epidemics of spinal meningitis were merciless. But in 1973, everyone from the girl's family and in the ER who came in contact with her were given miraculous antibiotics for a period of time as a preventative measure, and only one more case of meningitis happened in that community that spring. The word meningitis is from the Greek membrane, and itis for inflammation, indicating an irritation of the tough protective membrane that surrounds the brain and spinal canal like a raincoat. Meningitis means an infection has spread involving that membrane, and more important, the spinal fluid within, and generally starts from a nose, lung, or blood infection. There are many different kinds of meningitis infections, from bacteria, viruses, fungi, and more, but the diagnosis always requires a lumbar puncture and blood cultures. Historically, the most common bacterial causes for meningitis were from three very aggressive bacterial groups with fancy names: Haemophilus influenza, Neisseria meningitides, and Streptococcus pneumoniae. But things have changed since 1973. Now, in developed countries like ours, another miracle of science called vaccination has greatly reduced, although not completely eradicated, spinal meningitis infection from these deadly bacteria. A recent South Dakota death in a young man from meningitis who had been vaccinated emphasizes the words reduced, not eradicated. Our story of meningitis clarifies how infections can be so dangerous, how antibiotics and vaccinations have been very effective, and yet how life is so very fragile.